Chapter 20 is Physical Assessment. In order to properly diagnose and treat our patients, we need to gather a lot of information, and that happens in the history and physical. So you'll see here there are different categories of information that we gather. You should also remember the abbreviations that are used for things like chief complaint, that is what brings you to the doctor, history of present illness, what led up to this exacerbation of that problem, and your past history includes all of your medical and other problems. Current health status becomes important along with family history of illness. There are quite a few conditions where family history has an impact. Psychosocial history is gathered along with a review of all systems, and this information is called baseline. It's very important to establish a baseline because when you're following a patient, you need to discriminate what's normal from what is abnormal. I think this is a very fascinating part of being a healthcare professional. You have to be observant. You have to be inquiring. You have to ask questions and notice changes in condition. Assessment skills are very, very important for most healthcare professions. When there is a variance from normal, you need to report that to your supervisor. A general survey looks at the patient as a whole, and this overall impression is very valuable. So when you look at a patient, you're looking at things like posture and gait, manner of walking, signs of distress or pain, odors, color of skin, speech, level of consciousness. That all becomes part of assessment. Emotional status and mental status is very important to observe as well, and appearance can give you clues when assessing the patient. When you're gathering information about pain, it's important to note that pain is subjective. We often ask our patients to evaluate their level of pain based on a scale of 1 to 10, with 10 being the worst pain possible and 1 being no pain. The data that we collect also includes information about what are called ADLs. And these are activities of daily living. We want to make sure that our patients who are living in their own homes are able to take care of the things that they need to, and these are the ADLs. Vital signs is where we'll turn our attention next. We're going to talk about temperature, pulse, respiration, and blood pressure, and you'll get a chance to practice taking vital signs in class. For the test, it's important that you know the normal ranges for adults for each of these vital signs. Temperature, the normal range is essential to homeostasis. We sweat to remove excess heat. Afebrile means within normal range, and febrile means having a fever. Remember that a fever is a defense mechanism against pathogens, and it does stimulate the production of antibodies, but when a fever becomes too high, that can actually cause damage to the body. The pulse actually is when the heart contracts and forces blood out and into the arteries. This creates a pulsing sensation, and there are a number of different pulse points, as you can see there. We count the rate, the number of beats per minute, and we also take note of the rhythm, whether it is regular or irregular. Nurses and other healthcare professionals will also note the volume or strength, and the radial pulse is probably most often used to take the pulse, and that's what you see is illustrated there. The wrist, it's very important that you do not use a thumb to take a patient's pulse because a thumb has its own pulse. You'll see in this slide that 60 to 100 is normal. Bradycardia means a slow pulse rate, and that would be under 60. Tachycardia means a rapid pulse rate that's above 100. Respiration is the process of moving air in and out through the lungs. We inhale and we exhale. Upnea is normal breathing, tachypnea is fast breathing, and bradypnea is slow breathing. When you count respirations, it's best that the patient is unaware, because if they know you're counting their respirations or their breaths, that may alter the way they breathe. So we again count number of breaths per minute, and a breath would include both inhalation and exhalation as one, and also the rhythm. Blood pressure is another vital sign that's watched very closely, because high blood pressure actually can indicate problems in the body and can also do damage. There are a number of risk factors for high blood pressure, which you see listed here. I have a slide which shows you the new definitions regarding different blood pressures. So we no longer have pre-hypertension. We have normal, elevated, stage 1, stage 2, and hypertensive crisis. For this test, you should definitely know what a normal blood pressure should be, and that's less than 120/80. Blood pressure measures two numbers. The systolic is what we put on top, and that represents the pressure with contraction of the heart, and the diastolic is the number of the bottom, at the bottom, and that represents when the heart is at rest. Hypotension is low blood pressure, hypertension is high blood pressure, and a sphygmomanometer measures blood pressure along with the stethoscope. When you take a blood pressure, you have to make sure you use the correct size blood pressure cuff. Be aware of something called white coat syndrome. Some patients become anxious and their blood pressure is high in the office but not at home. And orthostatic or postural hypotension is something to be aware of too. Sometimes when people go from a laying down to sitting up, their blood pressure drops. That's one of the reasons you want to assist them and make sure they don't jump down from a laying position too quickly. Blood pressure readings do vary with age, medications, position, and mental state. Height and weight are also measured as part of a physical assistant. Height is usually stable after adulthood, but we start watching it again in the older years, especially in women, because a lessening of height can be a sign of osteoporosis. Be sure to follow with the response.